Thank you for watching. I just wanted to create a quick video called Public Health Basics, and this will serve as an introduction to this course, which focuses on health systems, policy, and leadership. Just wanted to start with a quick quote. A genuine leader is not a searcher for consensus, but a molder of consensus. And during this class, we're going to have a section that focuses on leadership. And so I just challenge you to think of what are characteristics of a good leader? Are you a good leader? And that'll be fun to look at later on in the semester if you can think of somebody who is a leader in your eyes and that you aspire to be like. So an overview of public health, we're going to look at a lot of these things here, not just specifically in this class, but throughout the program. We're going to look at health promotion, surveillance, monitoring, analysis. What are different outbreaks, epidemics? How do we study disease prevention, communication, risk, and research to continue learning about public health and disease and disparities and where we're at. So I hope you're enjoying this program and learning a lot about these concepts in your courses. So what is community health education in particular? Some of you might not be in the community health education focus. And what that means is it applies multidisciplinary theories along with behavioral and organizational change principles to plan, implement, and evaluate interventions that enable individuals, groups, and communities to achieve personal, environmental, and social health. This is what we'll focus on a lot in Assessment and Planning 552 if you take that course, which I think is required for most majors. And you will actually get the opportunity to pick a topic and do that plan, implement, and evaluate of the intervention to make a difference in a group or community that you select. Some of you are veterinary public health, and this provides veterinarians with a level of knowledge and skills beyond those gained during their professional education and additional education in food safety, food and animal production, zoonotic diseases, biosecurity, research methods, and public policy. So it's fun in this class, so we get to see a variety of majors working together and discussing policy. So what's the concept of philosophy? This is a core concern of philosophy of public health is the balance between the interests of communities and population and those of individuals. And these interests spring from two complementary and essential public health goals, the prevention of disease and the promotion of health and well-being. So that's the main focus right there of public health, the disease prevention and promotion of health and well-being. When looking at code of ethics, this is the mandate to assure and protect the health of public is inherently a moral one. If you take your CHES exam, which is Certified Health Education Specialist, there's a whole focus right on ethics, which is very, very important in the field of public health. And a code of ethics serves as a goal to guide public health institutions and practitioners as a standard to which they can be held accountable, right? We want to help people. We want to encourage people to make behavior change. We want there to be strong policies, but we also want people to have autonomy in what they do with their body, what they do with their community, what they're doing in the world. So it's very important to have that code of ethics, right? You know, we don't just want to be the police telling everybody what to do. We want to give them an opportunity to hopefully make the right choices. But sometimes it is important to have, policies on things like seatbelts, for example. I share this example a lot. So before there was laws on seatbelts, the rate was really low. There was a lot of education on it. People talked about seatbelts, but it wasn't until it actually was passed as a law that people had to wear a seatbelt. I think percentages jumped from like 50% to like almost 90% of doing it. So it's a good idea to have policy mixed with education and all that stuff that we'll talk about. I'm going to progress talking about Public Health 1.0 to 4.0. And Public Health 1.0 came out in the late 19th century, and it was systemized sanitation, food and water safety, expanded understanding of diseases through advancement in science. There was the development of vaccines, focus on prevention, and expanded capability in epidemiology. So, a lot of times, like we were realizing the importance of washing our hands and drinking clean water during this time, which was huge in expanding life expectancy. Then Public Health 2.0 came out in the 1980s, and it was defined as a core set of functions for public health, assessment, policy development, and assurance, and more focused on improving health through prevention, management, and treatment of diseases. It established performance standards for public health agencies, which is now today's accreditation standards, and it's increasingly professionalized public health agencies. Then Public Health 3.0 was a new era, enhanced and broadened public health practices that goes beyond traditional public department functions and programs. And at the core of Public Health 3.0 is a notion that local communities will lead the charge in taking public health to the next level and ensuring its continued success. Public Health 4.0 then, or rather Population Health 4.0, is a recognition of health as a global entity and focuses on identifying and eliminating health disparities. The focus is on population health management. While Public Health 3.0 required the development of health information technology, infrastructure, and understanding, 4.0 requires an even greater partnership with technology, allowing for advanced care management outside of brick and mortar structures, delivering healthcare to the most vulnerable where they are, which we saw this a lot after COVID. And the goal is to deliver improved, value-added, and cost-effective healthcare services to patients and enhance the effectiveness and efficiency of the healthcare industry. I did think this was important just to look at some of the five core recommendations or goals of 3.0. And it's discussed that health departments will own the role of a chief health strategist. Public health departments should engage in cross-sector collaboration. Health departments should seek accreditation. Health departments should collect and compile timely, reliable, granular level, actionable data that can be used. And funding for public health should be enhanced and substantially modified. And innovative funding models should be explored so as to expand financial support. So what is a chief health strategist? Chief health strategists will lead their community's health promotion efforts in partnership with healthcare clinicians and leaders in widely diverse sectors, from social services to education to transport to public safety and community development. And I think this is just so important in this class because we talk about leadership and collaboration and working with others. And oftentimes we don't want to work in groups or do those things, but this is vital in public health. I mean, if we don't work with all these organizations or individuals or employers, how will we achieve success? So what are some basic definitions that we should know before we move forward to this class? Well, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. Back in the 1900s, 1800s, definition of health was just absence of disease. If you didn't have the flu or pneumonia or tuberculosis, you were healthy. And today we know there's so much more to that. And a disease is a condition of the living animal or plant body or one of its parts that impairs normal functioning and is typically manifested by distinguishing signs and symptoms. So what are some dimensions of health? Wellness without disease or injury, wellness with disease or injury, illness with disease or injury, and illness without physical disease or injury. So we can see some examples of what different dimensions can actually look like. When measuring health, mortality is based on a few measures. You'll discuss this more in your epidemiology and biostatistics class, but we like to look at things such as crude mortality rate, age-specific and age-adjusted mortality, life expectancy, years of potential life lost, morbidity-based measures such as disability-adjusted life years, limitations, and years of healthy life. And these are measurements that show how healthy and thriving a country is. So looking at the US in the 1900s, 2% of the population died each year. Crude mortality was about 1,700 deaths per 100,000 people, and you probably didn't expect to live much past 47. Today, health more recently, crude mortality is 924 per 100,000 people, and life expectancy is 77.5 for both sexes. And I thought this was very interesting to look at with 2022 CDC data. Male life expectancy 74.8 and females is 80.2, which this is a huge jump from when I was a student. I believe it was 78 for both sexes, 76 for males, and 80 for females. I'm looking at the leading causes of death. This is just to remind you that we've come a long way from infectious diseases being the leading cause of death to more chronic diseases being the leading cause of death. I mean, only 4% of people were dying from cancer, 6% of heart disease in the 1900s, where now that's towering at about 40%. But again, we have to take into account most people are living well into their 70s, 80s, where people were dying in their late 40s. It is important to think about medical era updates. I found this study to be interesting, came out in 2024. Medical errors have been more recently recognized as a serious public health problem, reported as the third leading cause of death in the US. One study reported that approximately 400,000 hospitalized patients experience some preventable harm each year, while another estimated that 200,000 patient deaths annually were due to preventable medical errors. Moreover, medical errors have a high cost, with some experts estimating adverse events costing the healthcare system 20 billion each year. And so I have the link for the article in the slides that you can check out if you want, but this is something that definitely needs to be addressed from the medical standpoint and public health. We talked about COVID a lot over the last few years, and it was interesting to see how that ranked as one of the third leading causes of death in 2020. And we can now see, this should say 2022, but some of the numbers of deaths COVID has dropped to fourth. We're seeing less and less COVID deaths, but heart disease and cancer is still towering at first and second. I always think it's important to compare the US to other countries, and we'll talk about this later on, and we'll do a health comparison assignment with different countries, but just wanted you to take a look at, countries like Switzerland and France, and then the United States is here in the blue. Why do you think it's so different? Why do you think Portugal has skyrocketed there? Why do we think Switzerland's, high? What are countries doing good and what are countries not doing good? Healthy People 2030 will be an important concept that you understand throughout this program. And so I have this website for you here. We'll use it more in 552, where you'll actually pick a topic, but I think it's important to explore this, look at a topic of interest and see what the health indicators say about that. More basic concepts we'll cover throughout the class and courses here at UTK are One Health, population health, policy management, complex systems, and things like that. There are 3 levels of public health practice: community focus, system focus, and individual focus. As you can see here, we'll go right to the individual focus. This is specifically looking at the individual level with changes in knowledge, attitudes, belief, and practices. Where systems focused is more changes in organizations, policy, and laws, and community focus is more of the norms and attitudes in the community, which are all important and essential in public health practice. What's the concept of population health? This is that the health outcomes of a group of individuals, including the distribution of such outcomes within the group. So public health works to protect and improve the health of communities through policy, recommendations, health education, outreach, things like that. And it's important for healthcare systems, agencies, and organizations to work together to improve the health outcomes of the communities they serve. So our focus is group communities, not just individuals. So collaboration is mandatory for change, right? We can't just keep doing this alone. It is really important for organizations and networks and coalitions to come together to produce change. Here's just some principles for culture of health. Good health flourishes across geographic, demographic, and social sectors. Attaining the best health possible is valued by our entire society. Individuals and families have the means and the opportunity to make choices that lead to healthiest life possible. Business, government, individuals, and organizations work together to build healthy communities and lifestyles. No one's excluded. Everyone has access to affordable, quality healthcare. Healthcare is efficient and equitable. The economy is less burdened by excessive and unwarranted healthcare spending. Keeping everyone as healthy as possible guides public and private decision making, and Americans understand that we're all into this together. And these are 10 principles for a culture of health that should be practiced. Criteria for measures and culture of health actions framework include availability of national data, application to entire lifespan and health span, broad determinants of upstream drivers, appeal to multiple audiences, and focus on equity. So just some framework clusters include making health a shared value, fostering cross-sector collaboration, creating healthier, more equitable communities, and strengthening integration of all these services that I mentioned here. I have a video for you, and you can copy this in your browser if you want. It's just the concept of equity, and I think it does a good job demonstrating that. I'm looking at One Health. This is something that the veterinary students might be more familiar with, but this recognizes that the health of people is connected to the health of animals, the environment, and it's a collaborative, multi-sectoral and transdisciplinary approach, working at the local, regional, national, and global level, with the goal of achieving optimal health outcomes and recognizing the interconnection between people, animal, plants, and their shared environment. So the One Health perspective, what does it mean? Climate change means for humans, animals, and the environment, and growing human population means for humans, animals, and the environment. So animals, humans, and the environment are all essential to our success in the world. We're going to talk about management and leadership. I mentioned that earlier in this course, but we're going to be talking about this for about a few weeks in the class. And so I know I told you to reflect on some leaders that you've had in your life, but have you ever worked for a place that had successful management or not? And I'm excited to share some examples of that later in this class. So interdisciplinary, rigorous, and valid endeavor that they are all integral to human enterprises, and both are necessary and sufficient condition to ensure that the goals of public health are met. Leaders have a really complex and challenging job, but they are essential to our success. And we'll talk about some more complex systems here later in this class that we see. Some tools of a system thinker. So it's just kind of interesting. What kind of thinker are you? Are you more linear, circular? Do you look at parts of it? Do you like to see the whole picture? Do you like to work at isolation, relationships? What are the pros and cons of, all these things? Are there more pros? Are there more cons? So then, just to conclude, the phrase public policy is shorthand for the system of laws, regulation actions or interactions, and funding priorities of governing institutions. So throughout this class, we're going to look at this wheel and these 5 steps in the CDC policy process. We're going to reference something called Toolkit this semester, and it just has a lot of examples that you can use professionally, and I'll have this link for you as well. So just a parting thought, there comes a time when one must take a position that is neither safe, nor politic, nor popular, but he must take it because his conscience tells him it's right. So I will end there. Take care, everyone, and I'm looking forward to a fabulous semester.